Hi, I'm Dr. Greg Hall, and I'm here, and I'm so proud to be able to present to you my latest book called Better Black Health, a comprehensive guide in the age of precision medicine. What an incredible accomplishment. My wife and three grown sons over the last year have put together the quintessential book for Black health. Over 400 pages, over 200 all full color pictures. It's really a work of art. I'm so proud of it. And I wanted to do this video to kind of give you a quick overview of, what was inside. And so we initially start by talking about the foundations of Black health. Why are there health disparities? Why is there this legacy of mistrust? Why can't we all just be treated the same? That's one common question. We talk about your body's systems overall and kind of give you a quick overview of your cardiovascular system, your heart, your respiratory system, your digestive system, reproductive systems, and kind of get your grounding on that. Then we talk about prevention. What's some practical advice for the average African American in terms of what supplements they take, how many steps they should take a day, what foods they should eat. The fact that sweating is good for you, a lot of us don't sweat as often as we should, and that being deliberate about sweating can actually improve our health. We talk about, from the cardiovascular standpoint, your blood pressure. What should your blood pressure be? How dangerous is salt? And I'll give you a clue that it is dangerous. We talk about heart failure and peripheral vascular disease, and we talk about treating your cholesterol if it's elevated, and are there any side effects associated with taking statins? Talk about aneurysms and diabetes and the latest diabetes medicines. If people are losing weight and doing all these great things, we talk about that in a whole chapter. In the cancer chapter, we cover lung cancer, breast, colon, prostate, pancreas, stomach cancer, multiple myeloma, kidney cancer, and many more. Then we talk about mental health, which is so important. And, sometimes as African Americans, we can have a dysfunctional approach to mental health. And so we again, talk about anxiety, depression, post-traumatic stress disorder, bipolar, migraines, substance abuse, tobacco use. We even talk about gambling addictions, which are specifically different in African American communities. We go over reproductive and gynecologic health, male reproductive health. We talk about infectious diseases, respiratory health, kidney disease, skin problems. What's the secret to healthy skin and nails? We talk about tattoos and piercings and all sorts of arthritis and gout and lupus and fibromyalgia. We have a whole section on lifestyle and support where we talk about lead poisoning, raising children, setting a good example as an adult. We talk about nutrition and things that we should eat and things we should not eat. Some things that are based in the continent of Africa that might do us some good. We go over that. We spend a little bit of time talking about navigating the healthcare system, which can be very difficult, right? What do you do? How do you prepare for a doctor's visit? And how do you interpret your labs? There are some laboratory results that are specifically different in African Americans. Believe it or not, there are certain results that are slightly off. And unfortunately, a lot of clinicians and providers aren't aware of it, particularly if they're not Black. And so, there's differences in your hemoglobin A1C. There's benign ethnic neutropenia, where some people have a low WBC, a low white blood cell count, and they think something's wrong with them, when in reality, it's perfectly normal in African Americans. There's other tests, high calcium, hyperparathyroidism. We talk about how poorly the establishment treats our pain, including some episodes that happened particularly with me. We talk about surgery and all the top surgeries that people are getting: Brazilian butt lifts, breast reduction, breast enlargement. We also talk about Botox and injections there, which are kind of all the rage. We go over complementary and alternative therapies, talking about light, sound, and aromatherapy, acupuncture, yoga, how line dancing can be beneficial to your health. We talk about apple cider vinegar benefits and vanadium and zinc, garlic, ginger, and oil of oregano. We have a whole chapter on sleep, the benefits of sleep, sleep differences, insomnia, and sleep apnea. And we also have a chapter on inherited conditions that are genetically based, including sickle cell, thalassemia, and some couple other abnormalities that are really not abnormalities, but they're actually adaptations that we had to develop for survival. So Better Black Health, a comprehensive guide in the age of precision medicine. Precision medicine is using the genetics, your environment, and your habits, the things that you do on a daily basis to try to then customize the advice for African Americans. So it's the first book of its kind. There's no other book that covers all this information. Take a look on Amazon. This is it. $49.99 is the soft cover. $67.99 is the hardcover. It is the perfect Christmas gift. It's the perfect birthday gift because every time they open it, they're going to think of the person that gave it to them and how they brought better health to them. So think about looking at this. This video is really meant to be a quick overview. Better Black Health, a comprehensive guide in the age of precision medicine. Again, I'm Dr. Greg Hall. I look forward to hearing your comments and looking at your evaluations down below. Thanks so much.